Depression, paranoia, delusions, and hallucinations can develop at any point in the illness. Huntington's disease. Huntington disease is an inherited progressive neurodegenerative disorder characterized by choreiform movements, psychiatric problems, and dementia. It is caused by a cytosine adenine guanine trinucleotide repeat expansion in the Huntington gene on chromosome 4p and inherited in an autosomal dominant pattern. The pathophysiology of Huntington disease is not fully understood, although it is thought to be related to toxicity of the mutant Huntington protein. As there is no known cure, treatment is symptomatic and remains supportive. A 2022 meta-analysis that evaluated Huntington disease epidemiology studies published since 2010 made the following observations. The worldwide prevalence of Huntington disease was 4.88 cases per 100,000 persons. The worldwide incidence of Huntington disease was 0.48 cases per 100,000 persons per year. Clinically, Huntington disease is characterized by chorea, psychiatric illness, and dementia. Symptoms begin insidiously with movement abnormalities and with psychiatric and cognitive features. Motor presentations become increasingly common with advancing age. The course is one of slow but relentless deterioration in cognitive and motor function. Chorea is a key feature of Huntington disease, and the defining symptom at the time of diagnosis. Chorea is characterized by brief, abrupt, involuntary, non-stereotyped movements involving the face, trunk, and limbs. Initially, the movements are mild and may be misinterpreted as restlessness. Patients may be unaware of the movements and incorporate the chorea into purposeful actions, a phenomenon termed parakinesia. Gradually, the chorea becomes more florid and widespread, interfering with movement. In later stages, chorea also affects the diaphragm, pharynx, and larynx, producing dysarthria, dysphagia, and involuntary vocalizations. Patients with Huntington disease may present with irritability, depression, and/or disrupted social relationships up to several years prior to onset of chorea. Depression, paranoia, delusions, and hallucinations can develop at any point in the illness. Huntington disease is associated with an increased risk of suicide for diagnosed patients and at-risk family members. The suicide rate of affected individuals is 7%, while rates of suicidal ideation among Huntington disease mutation carriers are as high as 20%. Risk factors for suicidality in patients with Huntington disease include depression, anxiety, and substance use. Cognitive decline is inevitable in Huntington disease. Rarely, patients with onset of Huntington disease late in life may have motor symptoms only, presumably because the remaining lifespan is too short for cognitive symptoms to become obvious. The dominant cognitive feature of Huntington disease is executive dysfunction with diminished ability to make decisions, multitask, and switch from one set of cognitive goals to another. Patients typically lack insight into their cognitive deficits and may be unaware of their perceptual, motor, and psychiatric problems related to Huntington disease. I created videos on neurology and neuroscience. Please subscribe if you want to stay updated.